I had bad chest pains. Good thing we went straight to the clinic. It was pretty serious. They had to rush me to hospital. I was worried. At the hospital, they said it was a good idea to check my heart and have an angiogram. What's that? So they explained all about it to me, so I could decide to say yes or no to having it done. They told me, what is an angiogram? What happens before, during, and after, and the risk. So, what is an angiogram? My heart is a pump that needs a steady flow of blood to keep working. These are the pipes that bring blood. I might have blocks in my pipes. A block can make it hard for blood to flow through my heart. The doctors need to check these pipes for blocks. Blocks can give me chest pain. I've had some of those pains. They call these chest pains angina. Not heard of that before. Sometimes a block can stop the blood flowing completely. This is very serious. My heart can stop. This is a heart attack. I have heard of that. That can kill you. To check for blocks, they take a picture of my heart. Doing this is called an angiogram. Angiogram. A picture to show any blocks in my pipes. So, what happens before this angiogram? I couldn't have any breakfast. I was hungry, but not for long. I put on a hospital gown. I had my arms shaved, because that is where they will put a tube into me. Sometimes it's the leg instead. They brought me into the theatre on a bed. Now, during the angiogram, it takes about an hour. I lay on my back on the table. There are lots of nurses and doctors with me. This part can be scary. It's cold and lonely, but they do look after you. A nurse gave me an injection to relax me, but I was awake for all of it. They were talking to me during it and checking that I feel okay. The doctor put a tube into my wrist. That part hurt a little bit. But the tube going all the way to my heart, I didn't feel anything. When the tube is in place, a little bit of liquid is used to light up the pipes in my heart, where the blood flows. An X-ray machine moves over me to take pictures. It moves around slowly and can come close, but it won't hit you. They need to see the heart from all sides. Now the doctor can see inside my heart and any blocks. What happens next depends on how big a blockage is and how many I have. Some blockages can be treated with a stent. A stent is a small metal tube that keeps the pipe open. The doctor will tell me if they need to put a stent in. Most of the time, the stent can be put in during an angiogram. You may feel a little bit of heavy chest as the stent goes in. I had 2 stents put in to keep the blood flowing through my pipes. Sometimes there might be lots of big blockages. These might need heart surgery instead of stents. If you need this, it will happen later, after talking with you and your family. Phew! So that is what can happen during the angiogram. They explained it all to me, so I could decide if I would do it. Now, after the angiogram, the doctor and nurse talked to me about the result. If there are no serious blocks, you may be able to go home later that day. you will need someone to stay with you and to check there is no bleeding from where the tube went in. I have stents now, so it is very important to take blood thinning tablets, or the stent can block up and cause a heart attack. If I take the blood thinner tablets every day, the stent should stay open. The people in the hospital talk to me about other things I will need to do, like quit smoking, eating better, and doing some exercise. I got to get into that exercise. The Aboriginal health workers back home can help me with all this. Now, the risks. They said it is the best thing for me to have this angiogram, but there are some risks. Where they put the tube in, there is often a little bit of bleeding. The tube can cause infection. This does not happen very often. That liquid used might hurt your kidneys. If that happens, the kidneys usually get better quickly, or I might need dialysis for a short time to help the kidneys. There is a small risk of heart attack or stroke. This might happen to one person in every 500 that have an angiogram. There is a very small risk of emergency surgery or death from having this angiogram. This might happen to one person in every 1,000 people that have this procedure. If I didn't have this angiogram, I might have had a heart attack. That's the biggest risk. They explained it all to me, the whole story, so I could decide if I agreed to do it, to say yes to having this angiogram. They said, for me, it's the right choice. So I thought about it, and I decided to have it, to have the angiogram. So you will have to decide for yourself. It worked out okay for me, but you'll have to decide for yourself if you are going to say yes to having an angiogram.